Hi, it's Dr. Lewis Clark, back with you again today talking about functional health care for your thyroid conditions. How to overcome thyroid symptoms naturally. That's the subject of our discussion today. So we're going to get into part 3, and we're going to pick up right where we left off last time, where we talked about that blood tests are the key to success or failure in treating the thyroid. So remember the proper test, which we're going to look at a little bit more today, and the proper numbers, which we're going to look a lot at today. Okay, so that is the key. And so we're going to get right into it today. So how many times have you gone to the doctor and you get your lab work done, and then the doc says, well, everything looks okay, or everything looks fine, or everything looks normal. And you're like, well, doc, I don't feel normal. Well, guess what? There's a reason for that. And the reason is this. Medical doctors look at what's called lab ranges. Okay, now lab ranges, okay, are averages of everyone that goes in the lab. So I hope right now you're thinking that, wow, well, not everybody that goes in the lab is healthy. That's completely right and accurate, and that's a good way to be thinking, because lab ranges or lab values have never been a normal. They're an average of unhealthy people, but they are used for diagnosing diseases and conditions. Unfortunately, many people have started to call them normals. So if you have an abnormally low or an abnormally high lab value, then you have a disease, you have a diagnosis, you have some type of condition which is treated medically, which typically means pharmaceuticals, means drugs. However, what you didn't know is there are functional ranges or functional lab values. These are based on healthy people. They are represented here in our slide by the green range right here. This is the healthy range. So now you can see that between the healthy range and the lab range, there's this whole section right here that in the conventional medical office, you're going to be considered to be normal. However, you're obviously not in the functional or optimal healthy ranges. So therefore, symptoms can begin to arise in this area that's labeled here subclinical, meaning that you don't have a disease or condition yet, but you have symptoms. This is where we catch and help problems before they become a disease. So what does this really mean? What does it mean? It means that the inaccurate lab ranges that are being used are allowing you to continue to feel and get sick, even though your doctor says your labs are normal. It means you don't have a disease. It does not mean that they're healthy. We are going to be able to help you with functional health care in these areas. So let's look at TSH for an example. So we've been talking about thyroid, so let's zero in on TSH right here. Today, TSH values and labs, first of all, every lab has its own value because it's based on averages of everybody that goes in that lab. So the amazing thing is that the lab values in Dallas may be different than the lab values in Houston. Even in Kingwood, where I practice, may be different than those that are in Houston or than in another town, even here in our same state. So it's crazy to think that according to one lab's values, you may have hypothyroidism. Then you could move to another area of the state and you go to another lab and you have a totally different value. Now you don't have hypothyroidism. That's not a very good system. So the normal traditional values or lab values that are in our area are between 0.3 and 5.5, and it varies. Oh, the healthy ranges, the functional ranges that we're talking about based on healthy people is 8.8 to 3.0. So let's say yours comes in at 4.2. Well, guess what? You go to your doctor and he tells you, I don't know why you have depression. I don't know why you have constipation. I don't know why your hair is falling out and you can't lose weight, but it's not your thyroid. Is that accurate? No. It just means you don't have hypothyroidism, but you obviously do have an underfunctioning thyroid because you're outside the optimal ranges. This is the type of thing that's missed day after day after day, and unfortunately, year after year, because here's what happens. I had one patient I was dealing with when she went into her medical doctor, her lab values were 4.2, like you see here. This is an example. She goes back the next year. By the way, she has low thyroid symptoms, right? She's cold. She has muscle cramps. She can't tolerate any temperature changes. She has depression. She has constipation, brain fog. And so they say, well, I don't know what's wrong with you. If it's not your thyroid, why don't you try some Prozac? Well, not a good option, right? So she goes back the next year. Oh, it's 4.4 or 4.5. And they're like, well, it's not your thyroid, it's something else. And then finally, the third year, the fourth year, she crosses over this magical threshold here. And then all of a sudden, now she has hypothyroidism. Now, I think you can realize that this has been the problem all along. It's just getting worse and worse. And it's been misdiagnosed for 3 or 4 years. And this is a common scenario, unfortunately, in our conventional healthcare model today. So, what thyroid tests, first of all, are typically ordered? Only TSH and maybe T4. What kind of things do we need to see? A lot more. And I'm going to go through that specifically with you with the test that we run in our office. But I'm going to tell you that when you get minimal information from minimal tests, you're going to get minimal treatment at minimal cost. You know why? Because all of those tests, what tests were run and what treatments are done, were based on what your insurance company covers. And that, unfortunately, is why you pay for it in the end. I've said it before, I'll say it again. The most cost-effective form of healthcare is the one that works. It doesn't matter how little you spend on it if you're no better and maybe getting worse even. So this is what unfortunately goes on today. And so if you're basing your healthcare decisions on what your insurance company is going to cover, you are probably going to end up very sad and sick. This is where conventional medicine is geared, is it just at relieving symptoms and maybe treating a condition or disease with drugs, but never in relieving the problem or by preventing the problem from progressing. This is where functional healthcare differs. Functional healthcare is geared toward wellness and prevention, nutrition, and natural support and means to prevent disease or to reverse a condition before you develop a disease. And the difference in those two are night and day. So after years of treatment, you're not feeling better? Well, guess what? Could be. Maybe it's all in your head. I bet you've heard that before, right? Or, you know what, you just need to exercise more. Maybe implied that you're just lazy. Or, yeah, get on the exercise bike, right? You need Prozac, like we talked about a minute ago. Or maybe, just maybe, your doctor has dropped the ball by not doing the right test and not giving the proper healthcare interventions. That's the big reason why you're still having the symptoms, even though supposedly your labs are normal. Well, let me tell you something. It doesn't have to be that way. There is a bright future ahead of you, but you must understand that if you keep doing what you've been doing, you're going to keep getting what you've been getting. If you're happy with those results, then God bless you. Thank you for watching. You don't need me. But if you're not, you need me or someone like me that can help you get your life back. So that's what makes all the difference, and that's what makes us different, is this is the kind of healthcare that we offer here at our office, which is functional healthcare. Well, thank you for watching. I want you to continue to learn more. We're going to provide another video next week where I go deep dive into the lab test that you're going to need to have run and how the lab tests tell you where the problem is coming from. Because that's the key in the recovery, is actually learning, why do I have hypothyroid symptoms? So until next time, live life well. God bless.